I give my consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of assessing the student's competency in the Advanced Health Assessment course at MU.
Okay, you could lay down for me. We're going to start by looking at your abdomen. Looking at eye level, we can see that the abdomen is flat, non-distended, no pulsations and no masses. We do see multiple abdominal scars from previous surgeries, but they're well healed. The skin is pink, warm and dry with no bruising or lesions. Umbilicus is midline and inverted. There's even hair distribution throughout, and she is pleasant and cooperative. We're going to start by listening. We're going to start in the right lower quadrant with the diaphragm, listening for bowel sounds. And she does have normal active bowel sounds in all quadrants. Moving to the bell, we're going to listen for the abdominal aortic artery, right and left renal arteries, right and left iliac arteries, and then we have the right and left femoral arteries. And we don't hear any groovies. We're going to move to percussing, so we're going to percuss starting in the right lower, listening for tympany. And we hear tympany in all four quadrants. We're going to listen for tympany up until dull, and then we're going to listen for resonance down to dull, and that would be her liver span, which is about 6 centimeters. We're going to move to light palpation. And no tenderness and no masses felt. Deep palpation, I don't feel any masses and no tenderness. And now we're going to bimanually palpate for the liver, and we can feel the lower edge is smooth, and we are looking for the hepatojugular reflex, so we do see some distension when we push her liver, but it does dissipate. We're going to palpate for the spleen, the right kidney, the left kidney, and the bladder, but they're not palpable. Femoral arteries, 2+ pulsations, and they are regular rate and rhythm bilaterally, and then her inguinal nodes are movable, non-tender, non-edematous. You can sit up for me. You can see that her skin is not tenting, it's elastic. If you can look over to the door for me. We're going to go down below the 12th rib and check the costo-vertebral angle tenderness. And do you have any tenderness? You can lay back down for me. We're going to do a rebound test. I'm going to press in for 5 seconds. Let it go. Do you have any pain? We're going to look for McBurney's point. So we have her umbilicus and the ASIS 2/3 of the way away from the umbilicus. Do you have any pain? Iliopsoas test. Don't let me push your leg down. Do you have any pain or tenderness to your abdomen? And then obturator test. I'm going to internally rotate. Do you have any pain? Okay. And then the Murphy's sign. You could take a deep breath out for me. Feel where the gallbladder should be, and then take a deep breath in. Do you have any pain? Okay. You could sit up for me. You can see that her skin is pink. It's warm and dry. You can stand up. Throughout, I don't see any scars, masses, or any edema noted. If you could take a couple steps over that way and then come back. You can see that her gait is smooth, steady, and coordinated. So now we're going to palpate, looking at her spine. We're looking for deviations or pain, and there aren't any. We're looking for the acromion process in her shoulders bilaterally, olecranon process to the elbow, right and left, and then the medial and lateral epicondyles, the radiocarpal groove, metaphalangeal, metacarpal phalangeal joints, and the interphalangeal joints bilaterally, the iliac crest, and her greater trochanter. If you could sit down for me. I'm going to look at her tibial tuberosity bilaterally underneath the patella, the medial and lateral epicondyles, to look at her medial and lateral malleolus and the Achilles bilaterally. And then we have her metacarpal phalangeal joints and the interphalangeal joints bilaterally. And we don't feel any crepitus, no pain, and no edema. We're next going to do a range of motion. If you could start out with your spine, go ahead and flex, touch your toes your fingers to your toes, and then flex all the way back, extend all the way back, and then hyperextend. If you could bend laterally to the side, to the other side, and then rotate. We're going to look at her cervical spine. Go ahead and flex your head forward, bend your head back, lateral sides, and then turning. We're going to look at her shoulders. If you could raise your shoulders, if you could start out like this, and then go ahead and flex your shoulders back to the beginning, and you have extension, hyperextension, and then we have abduction, adduction, internal rotation, external rotation. And then we're going to move to her elbows. If you could flex your elbows, extend, and then if you can pronate, supinate, and then we have your wrists. If you could move your wrists radially and laterally, and then move your fingers for me, please. Okay, if you could sit down or lay down. We're going to flex your hips one at a time. And going back down would be extending, and she can hyperextend. Normally it would be face down on a table, but we can't get that way. So bilateral. And then if you could bend your knee and internally rotate, and then externally rotate both of them. And then we're going to flex your knee, extend your knee, hyperextend your knee for both of them. And then we have dorsiflexion for your ankles, plantar flexion, inversion, and then eversion going out. And wiggle your toes for me. So she has equal muscle tone in all of her joints, grade 5, and no, they're all symmetrical. If you can stand up for me. We're going to test her muscle strength now. All right, so don't let me go ahead and flex your neck. Don't let me go ahead and push against me, and then turn your head to the side. Your head to the side. Shrug your shoulders for me. Okay, and go ahead and flex your arms, and don't let me pull them down. Don't let me push them. And then your wrists, don't let me, fingers, if you could squeeze my fingers for me. Okay, don't let me put your, go ahead and flex your knees and your hips. This one. Okay, go ahead and sit down. And go ahead and lay down, sorry. All right, we're going to do your knees now, and if you can go ahead and flex your knee. Okay, both sides. And then go ahead and push on my hands, and then pull back up. Okay, so she has grade 5 muscle strength in all of her extremities. And now we're going to test for carpal tunnel syndrome. Well, actually, we're going to look at her temporomandibular joint. If you could open your mouth, close it, lateral, and then protruding, and then retraction. And then go ahead and clench your jaw for me. So she has equal tone to her masseter muscle, and she has equal movement in all planes for her jaw. So now we're going to do the Phelan test for carpal tunnel. Do you have any numbness or tingling to your thumb or first 2 fingers? Then we have the Tinel sign. We're going to tap the median nerve, both sides. Any numbness or tingling to the first fingers or the thumbs. And then we're going to do, if you could lay down for me, we're going to do the brush test. So we're going to brush up medially on the knee, and then brush down laterally, looking for fluid waves, and there aren't any noted for knee effusions. The ballottement of the patella, we're going to go down from the top, up from the bottom, and then push on the patella, and we see that there is no floating patella. McMurray's sign, so we're going to medially rotate the tibia and look for any meniscal injuries. I don't feel any clicking. Do you have any pain? So same thing for this one in all planes. And we're going to do a straight leg raise. So we're going to dorsiflex and inversion, eversion, plantar flex and inversion. Any pain in your lower back. Same thing for this one, inversion, eversion, plantar inversion. And that will be looking for a lumbar disc herniation. If you could stand up for me, bend over, touch your toes. We're looking for scoliosis, and this would be the forward bending test. And that would be it. Thank you.